An acne treatment product from several brands are now being recalled because they have elevated levels of benzene, which is a chemical that could cause cancer.
How much are those elevated levels will increase your risk of cancer? Hey, I'm a toxicologist and cosmetic risk assessor, and I will answer it with numbers. First, I want to say that I will be on the devil's side for this risk assessment. I will take a very conservative approach. I will take the numbers of the ValueSure report, although those values are not very accurate, if accurate at all. You can go to Lab Muffin Beauty Science to check her reel about why those values are way off, but I will take them at face value. From the report, I took 3 exposure levels based on their assessment, and I chose the 1800 ppm, 100 ppm, and 2 ppm. I started by calculating the systemic exposure dose based on 10% dermal absorption, which is way conservative considering that there are numbers of literature publication that shows that the benzene dermal absorption is way below 1%. And then started calculating the MOC, or the margin of safety, which represent the non-cancer risk. And what I mean by that, I calculated if you are applying this product and the margin of safety is way unacceptable, you might have an acute symptoms of benzene exposure, which mean skin irritation, barrier disruption, headache, dizziness, etc. And as expected, the MOC were not acceptable for the highest exposure and the middle exposure. But here is the juicy stuff, the cancer-related calculation. I calculated the cancer risk by calculating the LCR. LCR represents life cancer risk, which is an estimation of a probability of an individual developing a cancer or a tumor by being exposed to those compounds that are carcinogenic for a lifetime, which is 70 years. For the LCR calculation, I used the cancer slope factor of 0.03 milligram that is suggested by the EPA. And surprise, surprise, all the products, even the highest one, which has values that are way inaccurate, but I take it as a face value, all of them are considered to be under the safety threshold for the LCR calculation. And what I did is I calculated the LCR even when you are using the product and not using the product, because when you are not using the product, you are still exposed to benzene from the ambient air. And as you can see here, the value, all of them are considered acceptable. I even calculated the LCR increase between someone using the product and someone does not using the product. And there is an increase with the highest value of 56. You might get scared, but this 56 is related to the relative risk increase. It's not an absolute increase. As a toxicologist, I showed you with numbers and receipt that you don't have to worry, you don't have to panic, and even if you use the most contaminated sample, you will have no reason to be concerned.